In April, the National Cabinet made an important decision. Unlike New Zealand, Australia would not aim to get rid of the virus altogether.
It's still accurate, isn't it, that Australia's goal is flattening the curve, not total elimination?
That's exactly right. It's called the suppression strategy.
Suppression means that there's probably always going to be virus around, which in turn means that outbreaks are inevitable.
They will happen, and that could be a bumpy road on occasion.
With a suppression strategy, it means that there is always going to be this risk of outbreaks, and the goal is to get onto these outbreaks quickly and to ensure they don't spread. What's concerning here are the numbers. The numbers are significant. They're tiny numbers when you look at other countries, but for Victoria, these numbers are coming close to what we experienced in the first outbreak, and that's what's of concern currently.
So given that Melbourne's outbreak is unacceptable, what's the tolerable level of virus that we will have to learn to live with?
There's no single number of tolerable cases in the community that would trigger a change. We have to look at the spatial distribution of cases, how many of them are linked, and what that effective reproduction number is.
At the moment in Melbourne hotspots, the COVID-19 virus is spreading to as many as 2 others from a single infected person. The aim is to get the reproduction number down to 1 or lower.
That's a cause for concern and is the reason why we need to increase our measures in those areas.
One name for the strategy we're seeing in Victoria is ring-fencing, and it goes back centuries to the plague. But full-blown ring-fencing means both individual physical distancing and fully isolating whole suburbs with barriers, like we saw in China. That's nearly impossible to do in large, spread-out suburbs.
Now, what would tell us that this is not working? Well, it would be worrying, of course, if numbers continue to go up, though it's important to remember that any intervention, there'll be a lag period between the intervention and numbers either stabilising or going down. But if we saw new infections or new clusters outside of this geographical area, that would certainly be a concern.
The family is the source of most COVID clusters. The Victorian strategy relies on keeping infected people at home, sharing the place with non-infected relatives. Ring fencing often requires taking people away from their family into special quarantine areas.
I don't see any reason to do that, and the reason is that our approach to lockdown, which we did in Australia and we've done in many other countries and been successful, didn't do that. People stayed at home and numbers dramatically reduced. So I don't think there's a need to pluck people out of their homes and isolate them separately.
Still in a position where we can, with good public health measures and good compliance in the community, get this right back under control and back towards a Queensland or a WA-like scenario where there's essentially no cases. But it could easily go the other way at the moment.
For now, the best defences remain the most simple. Wash your hands frequently and thoroughly, and keep physical distance from others. And if there's an outbreak on, wear a mask in potentially crowded public areas. Plus, if someone asks you to have a test, or you have any symptoms at all, have one.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.